Hello, everyone. I'm Steve,
And I'm Scott.
and together we're Backyard Musings. Got an interesting episode for you today. Scott
Yeah,
Scott said it was weird.
it's kind of weird. Yeah, I mean, I wouldn't have figured that where you live is necessarily going to affect how long you live, but I guess they've been doing studies. But so today we're
Yeah,
going to talk
so
about.
a century-long study led by Yale School public health researchers reveals vast disparities in life expectancy across U.S. states. A groundbreaking new study from the Yale School of Public Health uncovers major differences in life expectancy across the United States. Over the past 100 years, where you live has played a huge role in how long you can expect to live. Published in JAMA Network Open on April 28th, 2025. Would you like to know more?
So would you have ever thought that this would be possible, at least in our United States of America?
Uh, yeah. I mean, the smoking thing, cutting off, banning smoking, that would increase health, I would think.
Well, okay, so you're saying that because, well, we'll talk about it, I guess, right? So, researchers analyzed more than 179 million death records from 1969 to 2020. So that's a pretty long span. Instead of looking at deaths year by year, they focused on birth cohorts or groups of people born around the same time. This approach gives a clearer picture of how early life experiences and long-term social conditions shape health over a lifetime. The study found that some states, especially in the Northeast and on the West Coast, saw big improvements in life expectancy, but others, particularly in the South, showed little to no progress over the entire century.
Now think about it. The South, tobacco, growing tobacco, North Carolina, South Carolina, Georgia, um, and then how California, Oregon, they ban smoking in public places. So I can see how this would provide an edge.
Okay. Well, again, it comes down to choice, right? Just because you grow tobacco doesn't mean you have to smoke it or consume it of some kind. So, but yeah, that's I guess that's one major aspect to look at. That's a big one. So, I mean, you could talk about diet too, right? People down
Yeah.
south usually eat more starchy type foods or fried
Well,
foods.
yeah, that too. Yeah, fried, starchy stuff down in the
I mean,
Southwest
and I'm not trying to
or
stereotype, but
Southeast.
that's but because they also, I know they also, I dated a girl in high school and her mom always had a pot of beans and a pot of rice. Always. When I'd go to her house, it was beans and rice or rice and beans. And it was a couple different kinds of beans, but always had rice and beans. So that's kind of healthy, I guess. You know,
Yeah.
kinda.
States in the Northeast and West, along with the District of Columbia, recorded the greatest gains. Notably, the nation's capital had the lowest life expectancy for the 1900 birth cohort, but improved by 30 years for females and 38 years for males by 2000.
Yeah. So that, okay. Well, that again, I don't understand the connection to all this, but by contrast, states like Mississippi, Alabama, and Kentucky saw minimal gains, particularly among women, suggesting that systemic factors like socioeconomic disadvantages, limited access to health care, and weaker public health initiatives have lasting impacts on mortality, researchers say.
I wonder how they account for, let's say I was born in Michigan, but then I joined the military and traveled all over the place and landed in California. I wonder how they account for that.
I don't know. Where did you do most of your growing up, I guess? Your formative years would have
Um,
been Michigan, right?
no, Michigan, I was only there for 17 years.
Well, but that's your
Um,
kind of your growing up years, right? That's usually where you
well,
start
yeah, that's the growing
habits
up
and
years,
stuff.
but I mean that doesn't take into account. They're saying regional trends, like you were saying, like starchy, fatty, fried foods may be the norm in one place, but healthy, ultra healthy foods may be the norm in another place. Smoking is okay in one, no smoking in another. So that could affect mortality,
Yeah.
not necessarily where you grew up.
Well, and maybe not even necessarily just foods, right? I mean, you grew up in Michigan, so I don't know how close your area was to Detroit, but Detroit used to be the Motor City, right? I mean, that's where they
Right.
manufactured a lot of cars, so there's a lot of manufacturing, which meant pollution in the air, coal
The
areas,
water quality also is
water
very
quality.
low. Detroit, Flint.
Yeah. Well, even recently, right, in Flint, we heard that big deal about their
Yeah.
water. So I
Yeah.
think a lot of factors that, I mean, I
Yeah.
would think that they would look at a lot of factors, but um, Pennsylvania area, lots of steel manufacturing, right? Again, pollution in the air, coal in Kentucky and West Virginia and Pennsylvania, and um, so I don't know, just yeah, lots of factors. So
All right. Here's a quote. These trends in mortality and life expectancy reflect not only each state's policy environment, but also their underlying demographics as well, said Jamie Tam, an assistant professor of health policy and management at YSPH and co author of the study. She continues, it's not surprising that states with fewer improvements to life expectancy also have higher rates of poverty, for example.
the researchers used an age period cohort model, allowing them to disentangle the effects of aging, historical events, and generational influences on mortality. This method captured how early life exposures, such as access to sanitation, vaccinations, or tobacco, shaped health trajectories later in life. So yeah, the way you
Quote,
the way you grew up, right? Your dad smoked, you probably smoked. Your mom smoked, you probably smoked. Uh,
yep.
just not always, but probably so.
Yeah. So, quote, looking at mortality trends by cohort gives us a more accurate reflection of the lived experiences of populations, Holford said. It shows that long term impact of policies and social conditions affecting the life course of populations that might otherwise be invisible in year by year comparisons of mortality rates from different generations.
The team also examined the rate at which mortality increased after age 35, which is summarized by the number of years it takes for individuals' risk of death to double. Longer doubling times indicate healthier aging. Again, researchers observed stark differences between states. New York and Florida showed slower mortality increases, while Oklahoma and Iowa saw faster mortality escalations.
Hmm.
Interesting.
Okay, Holford emphasized that these patterns aren't just a reflection of the past. Quote, the disparities we see today are the result of decades of cumulative effects on smoking rates, healthcare access, environmental exposures, and public health investments, he said. Without conscious policy changes, these gaps will likely persist or even widen.
The researchers pointed out to California and Kentucky as examples of how local health policies can influence mortality rates. California was an early adopter of smoke free workplace policies in 1995, which led to entire generations of young people growing up in smoke free environments, as well as generations of working age adults who were prompted to quit, the research said. See, I mean, yeah, it wasn't. And in 1995, I was not a smoker, but I wasn't into that. Um, People should have had. It's. Well, we won't get into the political aspect of it, but obviously it did some good. You know, did some good.
So in 1998, I was working in Pleasanton, California for a general contractor. And by that time, everything, all the bans had been put in place, banning smoking in public places, restaurants, and workplaces. But my boss, he was a vice president, the boss's boss, I should say, worked in an office way in the back. He smoked. He didn't care. He had an ashtray in there, and he'd smoke like a chain smoker. And you walk in to get a signature or something like that, or to talk about something, and the place is smoking. You're like, what is going on? So, I mean, some people accepted it, some quit.
That's one habit that was hard to hide. You
Yeah,
know, you 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 you, I mean, you could hide your drinking sometimes, depending on what kind of alcohol you consume, but smoking, no matter what it was, cigar, cigarette, pipe. I mean, that was a tough one to hide. But do you remember the smoking section and non-smoking section in restaurants? It was kind of a
airports
joke.
too. Yeah,
Kind of a joke, right? I mean, one booth you're smoking, and the next booth you're not smoking, and
right.
and then casinos, casinos in areas that not so much in California back then because we didn't have casinos like we do now, but if you didn't smoke in California, but you went into a casino or a restaurant in Las Vegas in Nevada for whatever reasons, they didn't have that. They hadn't adopted that yet. So interesting. But
in contrast,
Kentucky
essentially made no effort to control cigarette smoking, resulting in higher cigarette use and therefore higher mortality compared with California. Similar patterns for smoking and higher mortality were observed in West Virginia, Oklahoma, Arkansas, Tennessee, Louisiana, Mississippi, and Alabama, the study said. Lower socioeconomic status is also associated with higher mortality risk. States that are socioeconomically advantaged appear to have improved mortality rates more quickly than other states, according to the study.
Yeah, so a lot of those states that you just mentioned, those are tobacco, cash crop, right? I mean, that's a big deal for them. So the researchers hope their findings encourage greater focus on interventions like tobacco control, healthcare access, and environmental protections that can transform life expectancy outcomes for future generations. Quote, this research highlights the importance of viewing health through a generational lens, Tam said. Go on with a quote, the benefits of health interventions ripple across lifetimes. As Holford put it, where you are born shouldn't determine how long you live, but in America it still does. So yeah, I agree with that. I mean, I just, again, I'm not a freak about some of this stuff, but when you hear about water supplies in Flint, Michigan, or wherever, those today in my lifetime, I just think, how can that happen? With the advance that we have in science and in water purification, it just shouldn't be happening. It's like a third world country problem. It shouldn't be a country or a problem here in our country. So
my parents died in their 60s and they were in Michigan, mostly from smoking and drinking. My sister in Michigan, she died when she was 62. She had a lot of toxins spilled out into her body from, they built up,
Is that the one that just passed away? Was it last year? Last year?
Last year, yeah. She was young.
Yeah, I mean, and what did she do? Did she do anything specific for a profession?
She was not a health nut. She was not a health nut. And earlier on, she, smoked a lot of weed, alcohol. But then she quit after a while. I think she quit after a while.
Well, I think those things can definitely not help. Whether they're the sole contributor to her demise, I don't know, but it definitely can't help. So
let us know where you're from and if you've experienced similar things with family members dying or living longer. Like my wife's grandmother lived to 101. So let us know.
And has she lived a fairly, as far as health goes, fairly clean life? I mean, things in moderation and
no smoking, no drinking, moderation. Yeah.
Nice. Yeah, good for her.
All right, folks. Thanks for joining us. We'll catch you on the next one.
Take care, everyone. Thanks. Have a good day.